Recording in progress.
Hello viewers, welcome to my YouTube channel. Today we are going to discuss about macrocytic or megaloblastic anemia. So in this video we are going to see in further what is macrocytic and what is megaloblastic and why we call macrocytic and megaloblastic anemia. So let us begin with a definition. Macrocytic anemia is a condition and blood disorder characterized by the presence of predominantly larger than the normal erythrocytes, accompanied by low number of RBC, which means you can see here in the picture. So this is normal RBC size, and this is the larger, that is megaloblastic cells of RBC. So which means it says that like normal RBC and the megaloblastic RBCs. So megaloblastic RBC size of that megaloblastic RBCs will be increased than the normal, and also which will be accompanied by low number of RBC. There will be decrease in the total count of RBC. Why that happens, we are going to see in this video. Total count, right? So total count of RBC will be decreased, which often carry an insufficient amount of hemoglobin. Okay, there is because of due to decrease in the RBC count, so their capacity of hemoglobin will be reduced, and that will result in the insufficient amount of oxygen delivery to the tissue. Okay, so how this occurs, we are going to see in this video, as well as I have discussed this in the microcytic anemia. So I'll be giving that video description in the description. Next, we want to understand like what is the reason for megaloblastic anemia, occurrence of megaloblastic anemia. There are two major reasons for the megaloblastic anemia, that is decrease in the vitamin B12 level and as well as folic acid levels. Okay, so that is vitamin B12 deficiency and folic acid deficiency. So where we see where we can find these, what are the sources of vitamin B12 and folic acid, I have listed here. So mean like the food items which are abundant with the folic acid and vitamin B12 are as such like spinach, collard greens, asparagus, avocados, citrus fruit, and nuts, whole grains. Okay, all these are the sources for folic acid. But one thing to remember here, these vegetables and these food materials should not be boiled more than 10 to 15 minutes, right? This is because if these food items are boiled more than 10 to 15 minutes, the content of folic acid will be decreased. The content of folic acid will be decreased. Content of folic acid, right? This folic acid content, when we boil or cook for more than 10 to 15 minutes, then the content of folic acid will be decreased. Whereas in case of vitamin B12, these items, food items, has to be boiled before taking. Example, meat, poultry, chickens are there, and then egg and milk and milk product. And one more thing to note here, like pure vegan people. Pure vegan means who does not have milk and milk product also. Okay, they are basically vegetarian, but upon that they are not taking milk and milk products. Those people are called as an pure vegan. Okay, in those people also it is very common that risk factor will increase the deficiency of vitamin B12 and folic acid. And also few more risk high risk groups are economically deprived, indigent, and elderly patients, and all pregnant women. Okay, because elderly patients, the absorption capacity of the intestine will be reduced. That's why there are more chances of vitamin B12 deficiency as well as folic acid deficiency. Whereas in case of pregnant women, there will be increase in the demand and supply will be decrease. Decrease in the supply and increase in the demand. That is because the newborn baby in the womb will be that is also need the folic acid as well as the vitamin B12, because this folic acid and vitamin B12 are required for the cell differentiation as well as cell multiplication, right? cell dividing the cells like from parental to babies. like baby will grow because of cell growth only, right? So that for cell growth, vitamin B12 as well as folic acids are required. We'll see in the pathophysiology in this video. And there are some drugs which will alter the absorption of vitamin B12 and folic acid. One among those is phenytoin. And upper third of the small intestine is principal site for the folate absorption. And if there is any malabsorption or any damage to this small intestine, any diseases, pathological conditions might be there, or any diseases which causes, like which damages the small intestine, so then also there will be absorption deprivation will be there, and that may leads to folic acid and vitamin B12 deficiency. Further to this, we'll understand here what is like how folate metabolism occurs, like how that folic acid get absorbed in the body. So whatever food we take, that will be in the format of glutamate, polyglutamate form. So it has to be get converted into monoglutamate. So from intestine, so the food which contains folic acid, that will be in the form of polyglutamate. So this polyglutamate will get converted into monoglutamate by the enzyme called glutamate carboxypeptidase 2. This is the enzyme which converts polyglutamate into monoglutamate. Now these monoglutamates are available for the absorption, and that will get into the transportation of blood. So that comes in the systemic circulation. From there, it goes to the target cells. Okay, wherever the necessity of folic acid is there, so there will go there. There in the cell, it will get converted into dihydrofolate into tetrahydrofolate. So this is the tetrahydrofolate is the end product of folic acid. So this tetrahydrofolate is required for the DNA synthesis of many cells, DNA replication of many cells. So then after DNA replication, a new cell will be generated, new cell synthesis will occur, right? So what is happening here in this anemia, that is because of deficiency of folic acid as well as vitamin B12, there is defective DNA replication occurs, which leads to the megaloblastic anemia. So we'll see in further, so why how defective DNA generation is there, and why it causes a megaloblastic anemia. Okay, just have an idea of a cell cycle. It has four phases: G1 phase, S phase, G2 phase, and M phase. Okay, you can see here in the S phase there is a synthesis of DNA or DNA replication occurs. Before to the S phase, G1 phase is there. So G1 phase will accumulate all the necessary materials which is required for the DNA synthesis, right? So in between here, there is a checkpoint we call as checkpoint, which look after all the materials which are required for the DNA synthesis is correct or not, or proper or not. If it is not proper, this cell cycle will go behind and it will repair whatever the abnormal essential materials are there, it will get repair, or else the cell cycle will stop here only. Okay, there is no further proceeding of the cell cycle. Okay, same this thing you see here in the erythropoiesis. This is the process of production of erythropoiesis. Okay, so this is the synthesis or production of RBC. So which includes several steps. You can see here, this starts, erythropoiesis starts in the bone. Okay, so let's suppose this is the bone. Okay, a greater bone. In between here, there will be bone marrow, right? So this bone marrow contains stem cells. Stem cells. Okay, so in stem cells, this erythropoiesis occurs. So it occurs in multi-step. It is a multi-step process which has pro-erythroblast. Then pro-erythroblast get converts into basophilic erythroblast. Then further polychromatophilic erythroblast, and further orthochromatophilic erythroblast. Okay, till here you can see there is a nucleus inside it. Okay, after this phase, nucleus will be detached or ejected and new erythrocytes will be formed. Okay, erythrocytes, matured erythrocyte or reticulocyte doesn't have do not have nucleus in it, right? So until here, until where orthochromatophilic erythroblast, there is a presence of nucleus, right? So remember this, for nucleus contains DNA, right? So DNA is double stranded, DNA is required. So this the function of DNA. So there are so many functions: cell division, replication, and protein synthesis occurs by the production, transcription, and translation process, like DNA to RNA, that is transcription, RNA to protein, translation. So why I'm telling this thing is DNA is the precursor or the main element which are required for the synthesis of proteins as well as RNA and so many other intracellular organelles, whatever are there in the each cell. Okay, so the point of saying this this process is this vitamin B12 and folic acid are these two required for the synthesis of base pairs, that is adenine, guanine, cytosine, and thymidine. For the production or synthesis of these four elements of the, that is base pairs of the DNA, vitamin B12 and folic acid required. So what is happening in these deficiency anemia? There is decreased levels of vitamin B12 as well as folic acid. So as a result, there is no generation or synthesis of adenine, guanine, cytosine, and thymidine. If these base pairs are not there, then DNA synthesis will not occur. If DNA synthesis are not occur, then cell division, cell function will not take place in the proper way. Hence, the cell cycle, cell synthesis process will stop here only. Okay, you can see here the matured RBC have smaller cell size than the pre-erythrocytic phase. Okay, from here you can see larger size. Hence, in the blood smear, there will be larger cell size appearance in the slides. Okay, when compared to the normal size. So this is called as an megaloblastic. Okay, so I wanted to mention one thing in the beginning, as the title says, macrocytic and megaloblastic. Why we call these names? Okay, so until these cells stay in the bone marrow, it is called as an blast cells. Okay, once it comes in the circulation, then it is called as an site. Okay, so that is the difference in the bone marrow. If there is increase in the immature cells, so that is called as a megaloblastic, and these megaloblastic cells, if they comes in the circulation, systemic circulation, that is called as an macrocytic anemia. Yeah, you understood the difference. Why when we call megaloblastic, if the blood cells are in the bone marrow, then it is called as a megaloblastic. Once these megaloblastic cells comes in the systemic circulation, then it is called as a macrocytic anemia. In this type anemia, nucleus will be lagging and cytoplasm will be leading in the sphere, which means RBC will be having high cytoplasm, which means here nucleus will fall behind in the synthesis. Okay, whereas cytoplasm synthesis occurs in normal way, but the DNA synthesis, that is the nucleus synthesis, will occur slowly. Why? There is deficiency in folic acid and vitamin B12 deficiency, and there is decrease in these base pairs. This leads to the lagging phase of nucleus. And next is symptoms. There are specific symptoms with respect to vitamin B12 deficiency and folic acid deficiency, and there are also few common symptoms. What are those? We're going to see here. So fatigue, weakness, pallor, and glossitis are common for both vitamin B12 as well as folic acid deficiency. But the neurological symptoms and psychiatric symptoms are classical symptoms of vitamin B12 deficiency. Okay, these symptoms are not seen in folic acid. You can see here rare or absent. There is no occurrence of neurological and psychiatric symptoms such as paresthesia, ataxia, memory loss, irritability, dementia, and loss of vibration position sense, and confusion, psychosis possible. Okay, psychosis also can be seen, that is depression or mania, both the things with related to vitamin deficiency. With respect to hematology, so macrocytosis, hyperpigmented neutrophils, and pancytopenia are seen. Here also same symptoms are seen. Okay, and in the other findings, mild jaundice in both the condition vitamin B12 as well as folic acid deficiency. That is because the cell size of the RBCs are increased. Now spleen will recognize this as the foreign particle. That is because spleen knows only the normal size RBC. Let's suppose if this is the normal size of the RBC, then this is increase in size, right? So this increased size of RBC will be recognized as foreign particle to the spleen. Hence, spleen start destroying. That is the normal, even normal RBCs after 120 days, it will get destroyed by the spleen. But what is happening here in megaloblastic anemia, due to increase in the cell size, so this will be recognized as foreign particle to the pancreas. So pancreas will destroy. So that leads to the release of heme as well as globulin. Okay, so that causes the jaundice. Lab test, we can find in vitamin B12 deficiency, there will be decrease in the vitamin B12 level, and in folic acid deficiency anemia, there will be decrease in the folates. And methyl melalonic acid is required for the conversion of or binding to the vitamin B12. Hence, as a result, there is decrease in the vitamin B12. There will be more availability of methyl melalonic acid in the circulation. Hence, in the blood, we find more methyl melalonic acid in the both type of deficiencies. Treatment, we can treat vitamin deficiency, B12 deficiency with supplements, vitamin B12 supplement, and folic acid deficiency with a folate supplement. And diagnosis should be proper, because sometimes misdiagnosis of vitamin B12 deficiency can lead to neurological symptoms, because this is the only usually what happens. Uh, megaloblastic megaloblastic anemia usually occurs with folic acid deficiency. But if vitamin B12 deficiency is there, but we are providing only folic acid supplement, then this condition will not be treated. Okay, so hence we need to diagnose it very well, and then accordingly we need to prescribe. Next, just a tip for the day, that is sprinkling lemon juice on the food items, that is on the salad kind of vegetables what we have, and fully cooked kind of meat. Okay, meat or chicken gravy might be there, or anything. Okay, chicken items or meat items. So just sprinkling lemon juice, should not be boiled. This lemon juice should not be boiled, but should not be added in the curry or in the food while it is being cooked. Okay, so after cooking, when it is ready to serve, then we need to sprinkle the lemon juice in order to enhance the absorption of folic acid, iron, and as well as vitamin B12. Okay, so whatever food items we take, by adding just lemon juice, so it enhances the absorption of folic acid, iron, and vitamin B12. Just to recap, what we have discussed is the definition, causes of megaloblastic anemia, and then symptoms we had seen, and pathophysiology, and the absorption process, how vitamin B12 and folic acid get absorbed. Okay, so these are the points we have discussed, and the differential diagnosis between folic acid as well as vitamin B12. Okay, so these are the things we have seen. And if you like the content of this lecture, please do subscribe, like, and share with your friends. Thank you.